Hello, my name is Darryl Mesa. I grew up in Aotearoa, New Zealand, and I've worked for the United Nations Educational, Scientific and Cultural Organization, UNESCO, for a decade. I've worked for the World Health Organization and for the Food and Agricultural Organization. My field is bioethics and ethics of science and technology and medical ethics. I have a doctorate in molecular biology, and together with other colleagues from all around the world, we've been thinking, how can we contribute in this time of a global pandemic? So a few weeks ago we established the World Emergency COVID-19 Pandemic Ethics Committee. It's called the WeCope Committee because we can cope. We have the resources, the human capital, and wisdom from around the world if we can use that. We're an independent committee. We're independent of any government, of corporations, of any institutions. We can say what we think. We don't get funding from anybody. We speak for ourselves. And we hope for the power of reason and culture together we can find answers based on the evidence on how we should establish public policy in many different countries. This advantage of our committee of being independent, multidisciplinary, cross-cultural, of different ages, of different genders, and of different nations means that we hope what we do is valuable. We have members at the moment from Australia, Bangladesh, Brazil, Canada, China, Chile, the Delaware Nation, Germany, India, Iraq, Italy, Jordan, Iran, Japan, Korea, Lebanon, Malaysia, Pakistan, Portugal, Romania, Saudi Arabia, San Carlos Apache Nation, South Africa, Spain, Tewa Nation, Tajikistan, Taiwan, Tunisia, Thailand, Tanzania, Turkey, Uganda, USA and the UK. And we may have more joining us who share this vision of combining our expertise in different fields and our international experience to reflect as an independent body on what should be the response. How do we deal with the accountability of different institutions around the world? In the coming months, we will release statements and documents to discuss particular policy issues that people should reflect on and governments should reflect on. The first statement we agreed and released on the 23rd of April 2020 was on wearing masks and face covers as social responsibility during COVID-19 pandemic. I will read it. As experts in many fields, coming from many cultures and traditions and nations around the world, we declare that the scientific evidence, it's clear that there is an expected advantage to both individuals and those around them to wear proper face covers, including masks, in public during the COVID-19 pandemic. In the early stages of the COVID-19 pandemic, and the first an epidemic and then pandemic, a number of medical associations, professionals, authorities, governments, and the World Health Organization have stated that the lack of advantages of wearing masks, and they opposed wearing them, or even claimed to those persons who wanted to wear masks that there's a risk of wearing them. You shouldn't wear them because it may be they are wearing them inappropriately, or it may be it provides a false sense of public safety. Unfortunately, in only a few countries was mask use encouraged by the governments despite long-standing evidence of their effectiveness. and you can see the references in the statement. There appears to have been two common reasons for opposing mask use. One is a genuine ignorance of their effectiveness, and another is fear in many countries that there were insufficient masks for medical staff. Whatever the reasons, communication often was flawed, contradictory, unscientific, and/or deceiving, likely causing harm through increased numbers of people who were infected. This also has resulted in the loss of public trust in health leadership and management in some places at a time when trust is critical. Although by April 2020, most authorities have changed their advice to actively recommend or even compel citizens to wear face coverings and masks when in public, the question over failed public moral responsibility and the accountability for the erroneous advice should be looked at as a lesson of the COVID-19 pandemic. While some authorities order all persons to wear masks in public because of the social advantages, in case where there are limited supplies or affordability issues, other face coverings may still protect against transmission. Although we do not agree with fines or penalties against persons who do not wear masks in public spaces, that we encourage honest communication and education. The precautionary principle is widely recognized in international law, yet it was generally not applied well during the COVID-19 pandemic. Many people thought that they should wear masks, and we applaud their informed choice, as well as the advices of some governments to wear masks and even efforts to distribute masks to the public. Article 4 of the Universal Declaration of Bioethics and Human Rights states that human beings have both autonomy and responsibility, and that these should be balanced. We also still urge all in positions of authority at least not to discourage mask use by concerned persons for any political, cultural, racial, economic, or other reasons. It has been quite a contrast to look at policies announced in different countries over whether people should wear masks to protect themselves and or others from infection during the time of COVID-19. There is a very simple example here to illustrate the evolution of individual responsibility and group solidarity, although it's related to rather diverse cultural traditions around the world. We urge governments to be transparent in their assessment of the epidemiological analysis, statistics, and truthful in their public communication to uncover the scale of damage caused by any erroneous advice to citizens who wanted to wear masks but did not wear masks because of inappropriate guidance from the health authorities. In a world where authorities ought to be representatives of the people they serve and a reference for the informed choices that people make, truth, transparency, and inclusion in partnership with civil society are essential, and the respect for social responsibility is the ethical imperative. That was a statement on wearing masks and face covers as a social responsibility during COVID-19 pandemic, issued by the World Emergency COVID-19 Pandemic Ethics Committee. It is an example of a very easy to understand action that people can take. So we will be issuing more statements and discussions related to the emergency, to our reflections. Our meetings are open to people. We invite you to find us and join us. Thank you so much, and please stay safe and be concerned citizens.